Hello, everyone, and welcome to today's training for the Jiva Provider Portal training. Please remember to not put us on hold. Please mute yourself for today because there's quite a few people on this training. We are recording today, and this presentation will be available on our website soon. This is the first of 3 sessions this week for training. All sessions will have the same information. You're welcome to attend more than one. That'll be your choice. If you have questions, please enter them in the chat function and we will address them at the end of the presentation. So today we will review the changes to the upcoming portal and information needed to submit a request. There will be some new resources prior to our go live. This presentation will touch on some of the many resources that are available on our website throughout the presentation. What's new? So what's new is our provider portal is being upgraded. We originally planned this training with the expected go live date of May 1st. The go live date is now going to be June 5th. So there's going to be some refresher trainings offered in late May. Watch for those training announcements. There will also be some additional training, support, and resources for you prior to go live. And our staff can assist you if you're not signed up for the portal yet. This is the best way to communicate and to submit your request to us through the provider portal. All interactions are automatically time-stamped and are real-time entries. The view of our website does look a little different, but all of the information is still there and is the same. So this is our website now, and to find the Alaska page, you'll click on Programs and then select the Division of Healthcare Services, the Alaska Medicaid Healthcare Services button to get directed to our page. Now on the right side of the screen, you'll have the tabs or the sections previously it was on the left, I do believe. So here, if you click on contacts, this is how you'll find the link to the provider portal. Another resource on the website is the registration packet. If you're not already have access to our portal, you will need to obtain that access. Please download the registration packet and complete it. Once submitted, we'll send you access information in an email, usually within 1 to 2 days. Once you have all of the pages of that registration packet completed, you'll want to submit it to Justin and myself. And then, like I said, we will send you an email with that access information. When to submit a review. Remember to follow the Alaska Medicaid prior authorization list, as it does contain procedures and services that require a prior authorization. That list is at our website, comagine.org. And as I always remind people to look at the revision date of the PA list. Also, if you're submitting inpatient requests, there's the 3-day benchmark. And then we do review for everything retrospectively, both inpatient and outpatient that's on the prior authorization list. Here's a screenshot of that prior authorization list on the website. It's under provider resources. And then, as you can see, there are several listed there for the past few years. Also, I want to draw your attention to the imaging questionnaire listed here. That is a fillable form that you can offer to a provider to complete, and then you can just enter the information for them. Once you've clicked on the link to the provider portal, you'll be directed to the provider portal access page. You will want to click on the provider login. And then your next screen will direct you to where you can enter your ID and your password. And when we do go live, your current password and user ID will be active in that system. So there's no need to update your password prior to then. Once you've entered your username and your password, you'll be directed to the provider user and confidentiality agreement page. You'll need to click I agree to gain entry into the portal. If you say I disagree, it'll just take you back into the login page. So to use the portal, you do have to agree to this statement. Once you're in the portal, once we do our upgrade June 5th, it's going to look a lot different. This is the home page, and as you can see across the top, the black bar, you have home, dashboard, menu, your memory list. I encourage everyone to look at this home page when you log in, as this is where we will post announcements, training opportunities. When this training is posted on our website, we will list it here so that you know that it's available. And I'm going to turn this section over to Yvette Stratton. She's our executive director to help walk us through the upgrades to the provider dashboard.
Thank you, Teresa. And I just wanted to point out that when you log into the Comagine Health Provider Portal, your landing page is the home page. So that'll be one of the first things that you'll see are any updates or announcements that we post there. When you select dashboard, you're going to have this view, and this is where you can manage your work individually or by teams. And your administrator can set up your team. On the top right-hand side, there are two tabs. One says to do, and the other one says team. If you're managing your work individually, then you just select the to do tab, and it does automatically go there. If you wanted to manage work by teams, you would select the team tab. And you can also go to the left-hand side on the top left corner where it says alerts, messages, my requests, and gaps in care. If you're managing your work individually, you can select my requests, and a page will open with the list of episodes that you've submitted through the portal, and you can manage them that way. Another way you can manage your work on this dashboard is by work in progress. And there's a legend there that would show you what you submitted today, 1 day ago, 2 days ago, and over 3 days. Those colored links open to pages with the episodes listed there. You can manage your work by pending submissions. So those are your drafts that have not yet been submitted through the portal. Further information required would be those that either you left, well, the pending submission would be the ones you left in drafts, but further information required would be those that were submitted through the portal and were pended by our intake staff for additional information. So you'd want to look at those and see what was missing and respond to those. There's also pending a decision, and those are the ones that have successfully been submitted through the Comagine Health Provider Portal and being processed. Another way you can manage your work is by type. So you can manage it by inpatient or outpatient, as displayed here on the lower left-hand side of the screen. The colored-coded legend would show you what's been processed versus what's pending a submission, further information required, and pending a decision. The bottom right-hand side, decisions made in the last day, you can click on that circular link. It will open and display a page, and it's actually filterable. If you could go to the next slide, Teresa. So this is what would open if you pressed any one of those links. And you'll see that on the top left-hand side under Comagine Health, it has me, if I'm managing my work as an individual, or my team. So you can always have that view. The tabs under request by type are filterable. You can filter by inpatient, outpatient, or all. And then you can filter by pending submission, processed, further information required. You also have the ability to filter by date range, and you can actually put, there's calendars next to filter by date where you could actually put the date parameters in. Could you go to the next screen? So this is what the dashboard looks like when it's being managed by a team. Your team would be displayed in the top left side with your team members, and then you can manage the work by work in progress and request by type, which I just talked about. And that way, if someone were out of office, scheduled PTO or unscheduled, you can help manage the work so that you have a better line of sight into what's being submitted and what's being processed. And I think you go to the next slide. And this is how you would submit a new request or search for a request through the menu. So I will pass it back to Teresa for this part of it.
Okay, thank you so much for that. So yes, clicking on the menu, you'll get a drop-down box, and this is where you can create a new request. You can search a request, and I will show you here on the next screen. If we want to search a request, then you will put in the client, which is Alaska Division of Healthcare Services, and then you'll enter the Medicaid ID number. And remember, those Medicaid ID numbers start with a 200 or a 060 number. Once you hit the search, then down below, the members will populate.
I didn't get that. Could you try?
Oops, sorry. So this is a great place before you want to create a new request is to confirm the patient's name, their date of birth, their insurance ID, before going to the action icon on the far right where it says add a request. And this is where you'll select add inpatient or an outpatient request. So now that you have a request kind of initiated, to submit that request, you will need to enter all of the information, the request type, the treatment type, the treatment class, all of this information. And in our new portal, you will scroll up and down the page. There's not any tabs for you to click on. So here you'll have episode details and diagnosis that you'll enter. And as you can see, just going on down the page, you'll have a provider section. The information that you've submitted in the past, you'll still be submitting in the future in this upgraded portal. It just looks a little different, and there's just different places that you'll find to put that information. When you're submitting the information for the providers, you're still going to enter that facility or that provider's name. You can do a search or you can do an advanced search, which will give you some more options. Here we've, for example, listed General Hospital, and it starts to list on the right side of the screen all of the options. If you'll notice, we have little gears next to each of the listings here. When you click on that gear, you have an option of selecting a single attach or a multiple attach. We recommend that you do multiple attach. If you only need to submit, enter one thing and that's it, the single attach will work just fine. With the multiple attach, it allows you to attach all of them at one time. So once you start to check the different ones that you want to add, then you'll see the list of providers show up at the bottom of your screen. This is where you get to enter and update the provider role for admitting, treating, and requesting. Remember that requesting is how you get to see it in your dashboard, and you'll have access to the case. Once you have all three set, all you do is click the attached green button in the lower left-hand corner, and then they're all attached in one click. If you have an inpatient request, you'll have the stay request and the service request that you'll enter as appropriate. Remembering that with inpatient services, like surgeries and such, will require an ICD-10 code. Here's a screenshot for if you're doing an outpatient request, you'll be entering a CPT code for those requested services. We still have the assessments. You'll simply click the Add Assessment button. A box will open up depending on if it's an inpatient or an outpatient request. For inpatient, it's those initial medical requests that require you to complete the Alaska 3-day benchmark assessment, as you can see here on this example. And if it's an imaging request, then you would click on the Alaska Imaging Assessment. So this is a new step here. When you click on that assessment, it's going to ask for a contact name and phone number and fax number. We encourage you to complete this. And it just helps us to be able to reach out to you directly if there's a concern that we can't address through the portal. Next, here is an example of the Alaska 3-day benchmark. As you can see, it's the same information, the same questions. It just looks a little different. So you'll complete the assessment, and you click the Save and the Complete button. Here's a little bit more of that assessment as an example. It just looks a little different. You'll still complete the affirmations and acknowledgement statements before hitting that Save and Complete. And once you do that, then you'll see right below where it says Add Assessment, it'll have that assessment that you completed. If you click on that little gear, it does give you the option to preview it. An additional screen will open, and it'll have those details for you. It'll be under the report summary. You can still add documents by clicking on the Add Documents tab. You'll label your documents and then click the Upload button. Also, you'll have an opportunity to enter a note if you would like. And then you can save it as a draft and submit it later. Maybe you still need to gather some more information, or if you're ready to submit it, you'll hit the Submit button. And that's where this, in the lower left-hand corner, is that Submit button. What to submit with a request. Remember that we do complete reviews for medical necessity using interqual criteria, and we have org policies that are established by our multidisciplinary team that help to support and clarify interqual criteria. We will start using the 2022 interqual criteria June 5th when we go live with our updated provider portal. And then we do use your requests to screen for case management referrals. So for an acute inpatient prior authorization, you do want to follow the 3-day benchmark rule or the hot list. You'll want to include any codes on the Alaska prior authorization list that are necessary. And you will complete the initial inpatient assessment for those medical requests. If you have a concurrent review, we'll ask you to follow the next review date information of when to submit clinical for that next review if the person is still inpatient. We do need targeted clinical for that date, for that next review date. And any changes in the clinical presentation, if there's a discharge, or if you know that there's going to be any barriers to discharge, that information can be very helpful. A retrospective review is simply after services have been rendered or the person has already discharged from the hospital. And of course, that needs to be within timely filing status also. Sometimes retrospective reviews are a result of split bill authorizations, urgent requests if you needed to complete those services and then submit it after services are rendered. And remember with the retrospective reviews that the entire chart is not to be submitted. For retrospective reviews, if it's less than 30-day authorization for, say, an inpatient, we ask you to submit clinical every 3 to 5 days, along with the initial admission information and discharge summary. If a retrospective review is greater than 30 days in length, we ask that you submit clinical for admission every 5 to 7 days, and then your discharge summary. Imaging requests are valid for up to 4 months from the date that you request the service. And you as the provider, you get to set that time frame. If you know that the person is going to need repeat imaging, we encourage you to set that time frame a little shorter than the 4 months so that you don't have a claims issue with anything overlapping. With imaging, you still complete the assessment and any trigger assessments that will pop up for you. And again, there's that fillable assessment form at comagine.org if you need the provider to help answer those questions for you. If this is repeat imaging, please let us know that. That can decrease any delays in the request. If the member decides that they want to go to a different location for their imaging request, giving us those details is very helpful. And if that prior authorization had been completed or not. You can have multiple imaging requests on one authorization if they're going to be scheduled at the same time. If they're not going to be scheduled for the same time, then you do need to submit separate authorizations. You do complete an imaging assessment for every imaging request on that authorization. If that assessment is completed completely with all the information, you do not need to attach any other clinical, but you are welcome to. So remembering that, again, if that imaging assessment has all the information submitted with dates and the details, you don't have to attach any other clinical or documentation, but you can through the portal for those requests. Here's an example of what the new imaging assessment looks like once it's completed. It's the same questions. It just, again, looks different. And here's a screenshot of that imaging trigger assessment where it has the 3 questions and then the affirmations and acknowledgements that you will need to complete. For a surgical request, they are valid for 4 months once they're decisioned and approved, but your authorization will only show 1 date of service. If you need to adjust that, you can either enter a note in the case or you can give us a call and we can update that for you. With surgical requests, you don't do any kind of an assessment in our system. We do need those detailed surgical plan with that request. If it's going to be a staged surgery or surgeries on the same admission, then all of it goes on the original single authorization. If it's going to be staged and it's going to be on separate admissions, then you'll have them on separate authorizations. And if you end up with any code changes or amendments for those outpatient surgeries, you can either enter a note along with the operative report, or you can call us and we can give you information on how to send in the operative report. For a transplant request, those are valid for 6 months once they've been decisioned and approved. If the transplant has not happened in that 6 months, you do need to submit a new request with updated clinical for review. We don't do any kind of an assessment for the transplant request in our system. Typically, you'll submit an outpatient authorization request so that once your CPT code is approved, they can go on the wait list for the transplant. Once the person moves to an inpatient status for the actual transplant, you will need to supply us with the ICD-10 code for your billing purposes. For LTACs and rehabs, it's still the same. Admissions are valid for 7 days from the date of the approval for you to admit those patients. And then, of course, you'll follow the next review date for how long that request is approved for. With these requests, we do need clinical within 1 to 2 days of the request, and it is targeted clinical, but we do understand with LTACs and rehab requests, there is a little bit more that you submit for those authorizations. And there is not an assessment needed in GIVA for either of these types of admissions. Some other helpful information when you submit. Remembering that it's targeted clinical with date, current interventions, what is the plan, how long are they, the admission might be, and or the discharge dates. We do not need or are required to have the entire chart. The documents that you do attach, they need to be in a PDF, a JPEG, or Word document format. Our system does not work well with the TIFF format, so those are not accepted. All right, we've had a lot of information today, but I want to switch gears and talk about appeals and the options following a non-certification. And remember that these, you have all of these options. A doctor-to-doctor consultation, that is needs to be scheduled within 60 days of your notice letter. And there's information on your letter about how to complete those. You can also submit additional information, especially if the denial was based off of some missing information. That's a perfect way to submit those through the portal and just letting us know that this is additional information for review. In the past, it was called additional information in lieu of a doc-to-doc, but that's a little misleading because you have actually both options available to you. You also have a right to appeal. We have expedited and standard appeals. An expedited appeal must be filed within 2 business days of the denial notification, and it must involve urgent inpatient care. We will review the expedited request, and if that is accepted, we will notify you. If it's not accepted as an expedited request, we will still notify you and we will convert that to a standard appeal. We have case management here, and we look at a lot of your referrals to send referrals over to case management of, some medically complex patients, anyone that needs some discharge planning support, long inpatient stays, out-of-state care. Those are all great referrals for case management. If you're having a need for some case management from us, you're welcome to put in the request in the portal to say, can you refer this patient for your case management? And we can help with that. So we talked about a lot of things today, and just as a reminder, at our comagine.org, if you select that programs and go to Alaska Medicaid, there's a ton of information there, resources and some education things. That's where we're going to put today's recordings, is under the provider education. But the provider resources and education are some great areas to go look at. If you have new staff, it really helps to educate them on what we do and how we do it and how we can help you, that I encourage providers to look at. Our contact information, we do have a toll-free phone, and we are here from 6:30 a.m. to 5 p.m. Alaska time to help support providers. So we will move over to questions. I will check the chat and see what we have here. One person says, I missed the first couple minutes. Can you send out a copy of the slides for the webinar? What we will do is we will be recording this session. This is the first session of 3 this week. Each session is the same presentation, just different times of the day to help support providers. And what we will do is watch when you log into our portal, I will post when those are available. We will post the slide deck and the recordings for providers at that time. Next question here I see is, what is the process if a patient has 3 appointments on the same day? If there is an authorization already completed by one entity, do we not need to do another one? Okay, I'm not 100% sure. I'm going to try to answer this one, and if I don't answer you properly, please enter another question in chat for me. So when you say 3 appointments in the same day, remember that we do authorizations based off of the prior authorization list. So maybe, for example, if they have 3 imaging requests, that imaging request is going to need to have all of the codes that are on the prior authorization list that you want to get an authorization for. So if only 2 codes are there, you would still need to submit for that 3rd one. So again, if I didn't answer that properly, please let me know. The next one, if the pre-auth codes change, I can add a note to request the code be adjusted, or do I need to add a new submission? And that's a great one. So typically, some codes need to be kind of changed a little bit for your claims. So if it's an outpatient surgery, then yes, you will need to submit a note to us to say, I need to update this code. We will review that and determine if it's something that we can just update for you, or if a new request needs to be submitted. And we will communicate that through the provider portal for you. And the next one, did I understand that correctly? We can submit additional information review as well as a doc-to-doc. Can we do both for the same submission? And the answer is yes. The submitting additional information is a really good way if it was denied for some missing information. Or maybe you have some information to clarify something in that denial, that non-certification letter. You can submit that. You can also request a doc-to-doc, and one does not have to occur before the other. You can ask for the doc-to-doc. Sometimes during that conversation, your provider says, well, yeah, we have that information, and we'll say, please submit it. So that's when it can be one or the other first. Question, how do we complete travel taxi authorizations? That's not something that we do here. I would encourage you to reach out to Alaska Medicaid. they would be able to help you. They have a travel department, and they would be able to assist you with that. All righty, I think I hit all the questions. Yvette, do you see any others that I might have missed?
No, I don't see any other questions sitting right now.
Oh, I see one here. We always submit inpatient to inpatient transfers. Still submitting those? Yes. If you have a patient that's going from one facility to another for a variety of reasons, those are submitted on day one. When you receive them, or just as soon as you can, submit those, and we will review those. Those you do not need to complete an assessment for.
And again, I just want to add that at the end of May, we'll be providing live demos, multiple training sessions with live demos, a Q&A session, as well as providing resources regarding navigating the Comagine Health Provider Portal, a quick start guide for the dashboard and how to use the dashboard, as well as an updated provider registration packet if you have new staff that need to be added to the provider portal for access. And we'll also have quick start guides on how to submit a request, IP and OP, in the packet. And those will be posted on our website and provided during our live demos in May.
All righty. I'll give folks another moment to see if there's any additional questions.
One just hit, Teresa.
Okay. So it says we are always asked if the additional notes are in place of a doc-to-doc. When we do this, is wonderful to hear that we can do both. Thank you. Oh, good. Yes. So as soon as you submit some information, letting us know this is additional information for review. It's just clear to us what you're requesting, and that's very helpful. You can always also put in requesting a doc-to-doc, but you'll need to call into that doc-to-doc phone number to complete that. We typically have physicians available, and we can transfer your physician or provider right over to one of ours to complete that. If not, we may set up an appointment too, or just have your provider call when they are available. The same thing is if you're asking for an appeal, stating I request an appeal. It just makes it very clear as to what you're asking us for. Oh, another good question. It says, I missed the first 3 minutes, so it may have already been discussed. Is there a preference for a web browser for the new portal? Yvette, can you help us with that one?
Chrome.
Chrome. Okay, wonderful.
Oh, yeah, I'll double check and we'll add that information as well to our documentation and resources, which
Great.
are preferred browsers.
And that's another great one. Things like that, because I know that just trying to get to the portal can be, the biggest hurdle sometimes. So we will be putting that information on that home page also, those tips for, when you get signed in and things like that. Remember that you go to your administrator and they can unlock your password or update it for you. If your administrator gets locked out, then that person should contact us and we can help unlock them. So it says another question, just so I get this right, if our case managers are dealing with discharge barriers, can we contact Comagine case manager for help? Yes, we can do a referral and they can reach out to you or the member and see what they might be able to do to assist. Okay, next question. If we have an inpatient waiting for an authorization for a SNF bed, can we get assistance from the case managers to get a faster approval or keep the patient from getting denied while waiting for you to approve the SNF bed? So Comagine Health does not do the authorizations for SNF beds or administrative wait day beds. That is through the state of Alaska. So I'm not quite sure if our case managers would be able to assist in getting any faster authorizations. I know that those requests, from what I've been told, they do not do retrospective reviews. So if you have a patient that you don't think is going to meet inpatient status, we recommend and encourage you to reach out to the state of Alaska, to the Senior and Disability Services Department, because they are the ones that do those authorizations for you. And if it comes back approved, then you wouldn't submit to us anymore for any kind of an authorization. You would only work through them for those SNF or administrative wait day beds. Okay. And Yvette added here that Chrome or Edge are the preferred browsers that'll be coming up. Well, great. These are some great questions. I appreciate everyone. So thank you for attending today. After the sessions, we will be sending out a Survey Monkey. This is the link if you want to go ahead and grab it and go do that. And Tracy just entered that in the chat that you can copy very easy. And then there's also going to be a drawing for a gift certificate for those that complete the Survey Monkey. And I see one more question popped in here. It says, what do we do when an ICD-10 code changes to an outpatient CPT code and the authorization was for inpatient? So if you were originally approved for an inpatient, say, surgery, and it ended up that it was only an outpatient request, you do have to submit a new request with the CPT code and just let us know that that previous authorization, and if you can identify the reference number, the 88 number, that changed to an outpatient, then we'll be able to go ahead and process that request for you as an outpatient. One more question. How far back can we request retro auths for? From my understanding, Alaska Medicaid follows the timely filing rule, which is 365 days. So still be mindful of that time frame because we still have to do the review. It takes usually a couple of days for us to transfer that information to Conduit and Alaska Medicaid to be in their system so that you can submit that claim. So waiting until, the very end of that year, it might not make it in time. So I would give a little bit of a cushion there. Okay, I see one more question. When a patient has an auth for another facility, but they need to change to another facility, does a new request auto approve? So what you need to do is each authorization stands on its own. So if the patient is going to be going to one place of service and maybe because of location or special equipment, whatever, they need to change, then typically a new request with the supporting information needs to be submitted by the new place of service. And then those will be reviewed. Also letting us know that this is a change of location or change of facility will also decrease any delays because we're not able to approve duplicate reviews, but knowing that something is not going to occur changes that process a little bit. Okay. Well, those are all great questions today. Thank you everyone for attending. Please remember, if you can complete our Survey Monkey, that will get you entered into that gift card drawing. And again, we're going to do 2 more sessions this week. It is the same presentation. So it's up to you if you want to attend others. They were just simply scheduled at different times of the day to help support providers in your busy days. One more question popped in here real quick. It says, if we have a mutual patient who's been admitted inpatient, but our provider goes over to do a procedure, would we have to submit that request or would it be added to the inpatient request? So we review for prior authorizations for procedures. If it's a procedure being done during an admission, that something that has come up or it's unplanned, then we don't review for those procedures. So I'm not quite sure. My first thought is on this that you would not add it to the request, but you are welcome to contact us and we can talk about specific cases and members if you need to. All righty. Well, I'm going to go ahead and close out today's training session. Thank you so much and have a wonderful day. Goodbye, everyone.